Hello and welcome back to Omaha Mom Talks. I'm your host, Jessie Gutierrez, local mama of two and licensed mental health therapist. I'm so excited for you guys to join us on this amazing conversation today about the importance of pelvic floor health. Today, we are joined by Kayla Ives. She's a physical therapist and the owner and founder of the Pelvic Physio here in Omaha. Today, we're going to share about why pelvic health is so important, how it can help you during pregnancy, postpartum, and beyond. And we're going to learn a little bit about Kayla and how she started her clinic as a busy mom of two. Let's get into it. Omaha Mom Talks. Today, I would like to welcome Kayla Ives. She is a physical therapist and the founder of the Pelvic Physio here in Omaha. Welcome, Kayla.
Thank you. I'm so excited to be here.
I am so excited to chat with you. I know that pelvic floor and just pelvic health in general is so important for all women and especially moms. And so I'm super excited to dive into this conversation with you. We have some listener questions also that we'll get into later. And anything that we can get into.
Perfect.
Before we jump into this important discussion, tell myself and our listeners just like a little bit about you, anything about you growing up, family life currently, just behind the title, behind the job, like tell us about you.
So I'm one of the few people in Omaha that aren't from here.
Okay.
I'm from North Dakota originally. I actually grew up not far from Canada, so the accent slips out every now and again. But I met my husband when I was in PT school, and then we moved to Colorado.
Okay.
And that's kind of where I started to practice. And then in 2018, we moved here. He was active duty Air Force, so we got to see a little bit of the country before we decided to settle down. And
where did you go to PT school?
In North Dakota.
In North Dakota. Okay,
yep,
cool.
Yep. And then, yes, we have two boys. Our oldest is 10 and our youngest will be 8 next month. And so they keep us busy. I say my hobby right now is driving to sports.
Oh my gosh. So. I keep hearing, mine are still like little, so we're just getting into that. But so it's true. Like
yes,
I'm
a
taxi
carpool
driver.
Yes, carpool master right now.
Okay.
Yeah.
Good.
They're a lot of fun.
Love it. So you mentioned a little bit about your education, going to PT school. When did you decide that pelvic floor was something that you wanted to specialize and focus on?
And this is interesting because physical therapy in general was not ever in my plan.
Okay.
I mean, I was an athlete, so I had experience in physical therapy, but I truly, when I was younger, thought they were people that just counted to 10 3 times and then, switch an exercise.
Stretch it out.
Yeah. And it was just not exciting. And I always really wanted to be an OBGYN. And so that's where I put all my energy. I did a ton of shadowing. And then about the last year of college, I got to a point where I was like, I don't know if this lifestyle really is going to fit. I mean, it's demanding and I'm glad we have the people that do what they do, but I just wasn't as set on it. So luckily I was able to apply to PT school because the school I went to had a later application date, honestly.
Okay.
And then from the interview, I knew that it was the right place for me. And then, so my first round of clinicals, I was in Phoenix, Arizona, and there was a PT there, and she was phenomenal, but she said, I actually do women's health and pelvic floor. Have you ever considered that? And at that time, I hadn't even heard that there was a specialty, but I was like, heck yeah. I've always wanted to work with women, give them a safe space. And so I spent, a half a day with her, and I just watched her change women's lives.
Wow.
And it was so empowering. It was so impactful to just watch her give women hope and answers and allow them to feel heard in a space that they were uncomfortable with. And I was just like, oh my gosh, I have to do this. This is exactly where I belong.
Wow.
So then I graduated and had my first job in Colorado Springs. And I was so lucky to be in a clinic that there was already an established program for women's health. It wasn't, this was 11 years ago now. So there wasn't as many women's health clinics and it was definitely not as well known as it is now. But the therapists that were there were incredible. And they honestly shaped how I think of PT. And they kind of pushed me out of the box a little bit with like how you evaluate research, but also use your own thought process and patient experience. And they just really help kind of push that paradigm on how to treat.
I love that flexibility and person-centered.
Well, yeah. And just like, we don't always just have to be that 3 sets of 10 PT. Like, what does each patient need? And it was foundational for like treating patients in a holistic, individualized way.
I love that.
Yeah. And then, flash forward 2020 when everybody's life shifted,
yes.
it seems. My husband and I kind of decided that, that active duty military lifestyle was not for us. And so we were able to open the clinic, and here we are.
Okay. So
4 years
2020
later
is when you opened Pelvic Physio. And then how old-ish were your kids at that time?
Oh my gosh. So they would have been about 3 and 7, 4 and 6, somewhere in there.
Okay. So you're navigating the world kind of shutting down and changing, and then opening a business, mom of 2 littles.
Yes.
How did you manage it?
I think I'm very lucky to have the support I do. But truly it was a grind. It took a lot of hustle. I mean, everybody's business in the first 2 years, I feel like is hard. So it just was one of those things where I really leaned on my husband. And then, by the end of those 2 years, 3 years in, now you're at the point where you can develop a team, and now I can rely on them so much more. But man, in the beginning, it was really tough.
Yeah.
It was late nights, early mornings, and then, probably a lot more pizza and TV than you'd want to.
Yes, I understand. I always say, like, when you are a business owner, you're kind of always working. Like, whether I'm with patients, there's always things that need to be done.
Totally.
It's never just like, oh, I'm all cut up, and that feels so great.
Yes.
And when you have littles, right, it can be a hard challenge to balance, like, what needs to be done now, what needs my attention, and of course, like, our kids always need our attention.
I know, and I'm someone that's very like go and run, and I'm a go type of person. So it's hard. It was really hard for me to like decide when to stop. And I really, really had to work to put some of those boundaries in place, early on, so I could transition from work to mom mode and be there for my kids, because they're not little for very long, so it was definitely a learning curve for sure.
Well, congratulations on your business. I'm, as a perinatal mental health therapist, women are always interested about pelvic floor health. And I feel like this is going to be a great opportunity to just answer some of those basic questions that people have that are like on the fence of wanting to get started. So let's first just like very basic, what is pelvic health and pelvic floor, and why does it matter?
Sure. So the pelvic floor is a group of muscles in the bottom of your pelvis. And I could sit here and list off a bunch of fancy functions, but truly, they support your body. They're part of the core. They support your organs. They're very important for bowel and bladder function. And then they have a role in intimacy as well. So those are they're big, star of the show. Those are what they do. But they also, I like to tell women, every time you take a breath, every time you take a step, like your pelvic floor is working as a whole with the whole system. So it's so much more than just like, okay, I'm going to strengthen my core, or okay, like I'm having bladder problems, so I just need to work on my pelvic floor. We really need to look at it as a system-wide thing, because the pelvic floor affects really every other thing in your body.
Okay. So what are some of the common, reasons that you're seeing that folks reach out to you and schedule, no matter where they're at if they're a mom, not a mom, postpartum, all of that?
We see a lot of bladder leakage, especially, postpartum. And postpartum's kind of forever. So if you've had kids, you're
always postpartum.
Yes, you're always postpartum. So we see a lot of bladder leakage. We see a lot of, prolapse symptoms, where those pelvic organs aren't where they used to be, and they're starting to cause some issues. We see, pain with intimacy, and whether that was from like tearing from birth, or there's some muscle tension there. So we see a lot of that. Any pregnancy postpartum, those women are our people. We want to support them. And then there's pelvic pain. So that's low back pain, hip pain, especially in women. A lot of times it's related to the pelvic floor. And then conditions like PCOS, endometriosis. We obviously aren't treating those conditions, but 90% of the time there's a pelvic floor component that's causing some of their symptoms too. So it's pretty broad, but really anything that has to do with the pelvis or core, we would want to see someone for.
Okay. What are some of the common misconceptions that you hear about as it relates to pelvic floor, especially after childbirth?
We fight. The common is not normal.
Yes.
That is what we see all the time. And just because every other baseball team mom is peeing their pants when they're celebrating a home run doesn't mean you should be too, you know?
Yeah. So when I say that a lot in my industry about a lot of different things, so just because it's common, meaning it happens a lot to a lot of people, doesn't mean that it's normal or healthy, and certainly doesn't mean that you need to live like that for all the days of your life.
100%. Yes. And on top of that, just because your mom had to have a hysterectomy also doesn't mean you will either. So it's not like there's a lot you can do when you have symptoms so it doesn't end up getting there. And like I said, it's just, I feel like it's joked about so much with women, like, yeah, we just, we pee when we sneeze and we're crossing our legs. And just so to always like dispel that myth, like, no, just because your friends do doesn't mean you should.
Yeah, or have to.
Totally.
Or ever.
It's not.
Yeah. Yes. Okay, so give me some of the like telltale signs that a woman may experience that would indicate like you should seek professional support for this.
So obviously the big ones are like if you're leaking urine. That's the easiest one to spot. But also like we hear with low back and hip pain, I feel like we'll get people that call like, I don't know if I should come to you or if I should go to a regular orthopedic therapist we are ortho trained too. So it's not on its own. But what I say is if you feel like you have hip or back pain that's really deep, like if deep is an adjective you're using to describe your pain, especially in that low back hip region, it's probably pelvic floor involvement too. If achy, crampy pain throughout your abdomen. So those are when you would say, okay, this pain is different than something I would go see an orthopedic surgeon
and I
for.
feel like that's good information for my ears to hear, and I'm sure will be for so many other people, because so many women, I meet a lot with women before and after pregnancy, and back pain is just like, they think like, oh, of course I just did this amazing thing and gave birth. Of course I have back pain. Or they assume like it must be from my epidural or my hips, I need to go get chiropractic care. Right. And so I think it's important for us to hear that oftentimes it's very much related to your pelvic floor.
Especially in that stage of life, pain. For sure. And we work with chiropractors. Like I always think collaborative is better. And so, but pretty much if you're having some of those symptoms in that postpartum time frame, the pelvic floor is involved just because of what it went through during pregnancy and birth, C-sections too. So
yeah, that was one of our questions we'll get to.
Oh, good.
Sure. So during pregnancy, are there, I think some women think they need to wait, I guess, till after they deliver. During pregnancy, what do you recommend women do to support their pelvic health?
So women come to us and they think we've got this like special exercise that we're like hiding in this vault that we're not telling anyone about. But truly it's how can we stay as connected to the muscles that we have, specifically glutes and your core, like how can we stay as connected to that as your body changes? Mom butt is a real thing, and it's because of how your pelvis changes when you're pregnant. Your glutes don't work as well, and so we see a lot of that muscle loss. So what we do for women during pregnancy is we're saying, here's how we can stay connected to these muscles so we don't experience this muscle loss. Same with the abdominals, let's stay connected to the core just so postpartum it's a lot smoother and it's a lot easier for you to feel more connected with your body again and recover quicker. We also work, especially in pregnancy, we work with some breath strategies. So I'm going to say over and over again that breathing is important, and it's just a foundational piece of what we do. But the less pressure that you push down onto your pelvic floor or out into your abs, the less the damage there's going to be and the less likely you are to have symptoms. So we help women go through those breath strategies, understand when to breathe, how to stay connected to their muscles, and then at the end of pregnancy, we actually teach women how to push. So, it's a fascinating thing because I had my first baby, and to think that no one had taught me how to push, and you just get there and everybody's in your face telling you hold your breath, bear down. It's crazy.
Yeah, I wanted to hurt my husband because everyone's yelling and he's encouraging me, and I'm like, you think it's so easy? But yeah, it's like, how did I not watch a video on this at least?
Or someone tell me. So yeah, we actually coach that, and we try and coach different stages of labor and how you should position. And even if you use none of it, it's nice just to sit there and kind of walk through, and it almost is just gives you some preparation for what you're going to go through too.
Yes, I love that. So important. Great. So for those that are just curious and maybe hesitant to make an appointment, they're thinking about it, can you walk us through what to expect with an initial appointment? I think a lot of folks that I talk to want to know specifically how invasive is it, and how maybe is it similar or different from a PAP?
Yeah, it's only invasive as you're comfortable with. That's what we always say. We're never going to make you do anything you're not comfortable with. And honestly, sometimes you just want to meet the person that is going to be doing your evaluation treatment and then feel comfortable before you take that next step. So we're always open to that. But what it looks like is, so we're going to come in and we're going to kind of we'll do a head to toe screen. So we're going to look at your neck and your upper back and your lower back and your hips. And so this looks a lot like a regular orthopedic physical therapy appointment would. We look at patients' feet because we want to know, yes, we know pelvic floor is probably a problem if you're coming in with bladder leakage, but ultimately it's not the reason you're having symptoms. Okay. The reason you're having symptoms is outside the pelvic floor, and the pelvic floor is just affected. Okay. So we want to identify kind of up and down the chain what's going on. And so then when we do a pelvic floor exam, we want to see that, okay, they did have limited hip motion. We see that also in the pelvic floor. That makes sense. And we just want to make sense of all the symptoms because that helps us explain it to the patient too. Mm-hmm. A pelvic floor exam, it is an internal vaginal exam. We use one finger. We don't use stirrups. We don't use a speculum. You're covered the whole time. So it's way better than going to the OB. There's
great to hear that.
Speculum coming out of nowhere, So it is way better than that. And we just, the whole time we're kind of talking to the patient, like this is the information we're gathering from this, This isn't about just weakness, and that's another misconception too. This isn't just about weak pelvic floor muscles, which is so often what people think. Like we want to really see where's the breakdown in this full system? Why is the pelvic floor a piece of this? And then kind of build from there. We also, on that first session, give people a full treatment too, because our goal is even after that initial eval, we want you to already feel better.
I love that.
Yeah. The worst part is like when you have to go somewhere and then you have to wait for your treatment the next time.
Now I have an idea what my problem is and how you can help me, but now I have to wait another
2 weeks.
Yeah. So with that first appointment with your clinic, what are your thoughts on bringing baby or kids?
Oh, please bring them. So I have my front desk and tech that will gladly watch your kiddos for you. Toddlers, they run a full school out there half the time, it seems like. And then, baby can stay with you. You can nurse while it's happening. We can hold. The therapist will wear babies sometimes, or like I said, my tech will hold babies.
Great. Love it. So lots of support.
Bring them in.
We understand that if you're home, especially on maternity leave, of course, you don't have childcare, so bring.
And also, please don't pay for childcare to go to a pelvic floor appointment. Yeah. Go to dinner with your partner. Pay for childcare there. Like we want to make it as easy as it can.
I love that.
To be able to serve as many women as we can.
I love that. Great. So I hear a lot of women who are like, there's a big emotional side to this. There's a lot of embarrassment. There's shame. It can feel very overwhelming just in this big transition of postpartum. How do you navigate and support the emotional side for your patients?
Yeah, we collaborate. So we recommend mental health therapy if necessary, but we take the approach of like, let's meet our patients where they're at. So we have some moms that, did CrossFit their whole pregnancy and come back and we see them 3-4 weeks postpartum. And those moms are probably going to want a little bit of exercise and a little bit more than we would give someone that feels like very overwhelmed and doesn't have as much support at home. And so we just try and meet patients where they're at with that. Early on postpartum too, we don't really give patients a ton of exercise. What we do is we try and help them incorporate movement patterns into what they're already doing. So this is how you pick up your baby. This is how you find your glutes when you empty the dishwasher. Like you're already doing these things. It's overwhelming the amount of time that babies take and you're exhausted.
Yes.
So the last thing you have time for is 20 minutes of our exercises.
New exercises that you've never heard of and are awkward.
So we're like, okay, you're nursing great. Let's find your lower abs again. Okay, we need to work on those abdominal obliques. Like, let's rotate when you're behind a stroller. Like, let's put this into what you're already doing. So we're not trying to add to your plate.
Right.
And so again, we just meet them where they're at. But there are patients that are like, no, I'm ready. It's 3 weeks. This is mentally really hard for me to not be moving. And so then we're like, great, here's some movements that you look good doing that are going to be totally safe for where you're at. Let's get you doing those again. So again, the biggest thing is just meeting patients where they're at.
Great. With one of the things that moms that I support, I hear from, no matter what the medical thing is that they need, is they delay making appointments or prioritizing their own health. What would you say to those moms that are listening that to encourage them to prioritize their pelvic health?
Right. I know it's tricky. Sometimes I joke, like, I wouldn't be able to do our plan of care sometimes, like we want to see him once a week for a little while. And so there's a lot you can do if you're not ready to be seen, just with breath and making sure you're exhaling. So people are always kind of like, what are your tips? What are your pelvic floor tips? And so I always say, exhale with any effort. So like if you're going to lift your kiddo, exhale. If you're going to like stand up out of bed, if you're picking something heavy, just make sure you're exhaling, because that's taking pressure off the pelvic floor. And that's the number one thing we teach right away, is how to manage that breath. We also talk about muscles need to relax as much as they need to contract. And so I'll hear people like, oh, I'm working on my abs. I'm holding my abs in all day. And that's actually causing more issues than it's helping. So making sure that you aren't clenching your glute muscles all day and not clenching through the pelvic floor, just getting that relaxed. It's actually going to help your body use those muscles better.
Okay.
So we talk a lot about that. And then, if someone's like, I'm too busy, I just can't make appointments. At the end of the day, what we know in the research is the stronger you are, the less likely you are to have pelvic floor symptoms, just generally. So if you can only get to the gym right now, just know that you're still doing the right things for your pelvic floor. Obviously, we want to see people that are having symptoms, but we understand it's not always going to fit. So those things are kind of like, if you are already strength training, great. You're working in the right direction there. Okay. Just make sure you're exhaling.
Okay. Yeah, that's an important one. And that's funny too. Whenever I tell people take a deep breath, I'm like, oh, don't exhale. You forgot.
Yeah. Let it out.
Heart's important. With the moms that are interested in pelvic health, I think they're also like, how long should I expect to be doing this? Like, is there an average, or is there an expectation of like, how long will I be receiving pelvic floor therapy?
And with anything, it depends. That's always the answer for everyone. So, if you've had 25 years of symptoms, it's going to be longer. But typically on average, like if we're noticing symptoms postpartum within a 2 to 3 year time frame, we're going to hope to have you about 75% improved within the first 3 to 4 visits. And so what we do is we see patients once a week for about 3 to 4 weeks. And then we have them actually space out visits. So we'll go every couple weeks or every month. And because, our bodies and our pelvic floors are just influenced by so many things. So stress is going to change your symptoms. Your hormones are going to change your symptoms. So we want to see women through a lot of life versus like, okay, yeah, three treatment sessions in a row, you're good, bye. So that's just not how we treat. So it's actually like, there's not a ton on the front end with us. You got 3 or 4 appointments, and then we're going to really space out those sessions. Truly, we tell every woman, like, even if you can only come in for an eval, great. We're going to let you know what's going on, why it's happening, and then we're going to kind of try and guide you into what to do to really help yourself out of these symptoms too. So even if you can only do the eval, that's a great place to start.
Give you some homework.
Yeah, absolutely. And then, a year from now, it might be a better place to start, but you've had that year where you've already been working on, those foundational things.
Mm-hmm. Share with me how you as a provider or your clinic supports women who either have birth trauma or sexual abuse or have that type of history to ensure that they feel safe and comfortable. I'm guessing that is something that you guys see a lot and have experienced. And I want to make sure that moms that are listening know that you're equipped to handle and help them feel comfortable.
I would say about 50 to 60% of our patients have some sort of trauma, whether it's birth trauma, childhood trauma, sexual trauma. And so we just do our best to go slow. And we want the patient to always feel empowered. So we kind of let them lead the way a little bit and what are you ready for today? Because sometimes it's something as simple as a patient doesn't want to lay on their stomach because that feels very vulnerable. Mm-hmm. Or a patient doesn't want to be put in a position where they delivered because that is very triggering. And so we always have that open communication, and we're going to just kind of let them get comfortable. And we're never going to do anything that somebody is not comfortable with. And so we just, again, meet them where they're at. Yeah. And whatever they're comfortable sharing, we're going to make sure they feel that they have support from a partner or a therapist, and just make sure that side, they have that side too. And sometimes we've just spent the first session just talking because you need to get to know someone before you feel comfortable, especially when what we do is so manual therapy, physical touch heavy that we don't want to trigger anyone. So let's get to know each other. We'll talk you through what's going on and then get them to a place where they feel like they can take that next step forward.
Great. So your providers are used to taking it slow, building that relationship, and going at a pace that feels comfortable for each woman.
Yes.
Perfect. So I know I can probably list off my head like why I see the value of seeing a specialist like you or at your clinic. But for those who have like maybe been referred to a big physical therapy type clinic or hospital, what would you say is the benefit of choosing like a specialty practice like yours?
Yeah, we are just trained a little differently in getting to the root cause of the problem. Because kind of like I said, I'm going to say 95% of the time, it's not the pelvic floor that's the issue. It's something outside of the pelvic floor that is contributing to your pelvic floor being tense, whatever, not functioning the way it should. So I feel like as physical therapists in our training, we're taught this is how you strengthen the core. This is how you strengthen the pelvic floor. We're not taught this is how you evaluate it. This is how all of these other muscles play into it. This is how your foot makes your pelvic floor fire. Like, we're not taught the whole system-wide approach. And so, it's kind of like women that, they may download a Kegel app. I always hear like, I have a Kegel app and I do my Kegels. And it's like, well, great. That's going to help you have awareness of what your pelvic floor is doing. And it's probably going to have some symptom improvement. But when we look at like not having symptoms return or that 100% resolution, you really have to take it a step beyond that. And so truly, as PTs, we're not trained in that. We all go to additional training, additional certifications to be able to understand the full scope and the holistic scope of it. So that's just what you're going to get. And we see a lot of patients that have failed PT before and failed pelvic floor PT before. And again, most of the time it's because that provider that they saw, and not anything against them, but just didn't look outside the pelvic floor. And, just really focused on like, okay, let's get stronger. And PTs are known for getting stronger and stronger, not using your body in a coordinated fashion, in like a contract relax fashion. How does this affect the other areas? And that's where we see our long-term improvements, is when you look outside the pelvis.
Okay. So I want to jump into some of these listener questions because that kind of what you're talking about right now. So one of the questions was, will I need to do these exercises forever? I've gone to 2 different providers and I still keep leaking occasionally. And I heard you specifically say like complete resolution. And even in my brain, I'm like, does that exist for like moms that are peeing their pants? So tell us.
Yeah. So our goal is you're going to have to do a specific set of exercises more than likely until you're symptom free. And then we should have you in a solid exercise routine. So the way you breathe or what you're doing in your strength training or Pilates or whatever it is enough to keep you symptom free. Because at the end of the day, the pelvic floor is just another muscle in your body. And when it's functioning healthy and it's functioning correctly, it's going to be strengthened when you're doing squats, when you're doing lunges, when you're doing your other core exercise. And so, no, you should not, if you are stuck in these 3 exercises that someone gave you, there's a missing component here, because in any PT, you shouldn't have to continue to do those exercises. It should fall within your exercise routine that you enjoy, that is a part of your life. And it shouldn't be like, okay, I have to do these 3 exercises before bedtime for every day for the rest of my life.
Okay. Good to know. Great. Okay. Another listener question. I had a C-section. Is pelvic therapy still helpful for me?
Absolutely. So there's a lot of different aspects here. So your pelvic floor still supported that baby for 9 months. And so that's a lot of demand on those muscles. It's a lot of demand on your hips, your back, all of that. So we're going to look at that too. The problems don't just come from delivery.
Right.
It comes from being pregnant, and stuff that you even had prior to pregnancy that you just didn't know. And then too, with C-sections in that healing tissue, we can do a lot for the scar. So, with the scar mobility, it can impact some of the bladder symptoms, how you connect with your core again, even how that pelvic floor fires. And so we really want to make sure that scar tissue is healing well, moving well. You know, I mean, people talk about their C-section shelf all the time where like it gets really scarred down, and we want to avoid that as much as possible. It's not always possible, but just to help with those abdominal healing, I mean, we can do so much just for the scar alone.
Okay, great. Perfect. Okay, next question. Will sex ever feel normal again after baby?
Yes, it should. Yes.
Okay. And is this an issue that you're seeing?
Yes, we see a lot of painful sex. And it's not always from baby. Like, we have a lot of younger women that have never had kids that have pain with sex too. So there is a lot of things that could be contributing to the pain with sex. A lot of the time it's muscle tension, so that a spot or all of the pelvic floor is tight. And if you think about like when you have tightness in your neck, you don't want to poke it. So it bothers you, you know, if you do that. So it's the same thing with the pelvic floor. And so we would really want to evaluate the muscle tension just to make sure the muscles can relax enough. And then, you know, there is different things that can happen with organ placement and where your organs are postpartum with that prolapse piece. And sometimes that's uncomfortable, but we work with women on positions that are going to be better for that. And honestly, we see women for prolapse to improve those symptoms. So there's a lot of things we can do. But yes, sex should return to enjoyable.
Sex shouldn't be painful.
Not
it should be
painful. Yes, for sure.
Okay. Next question from our listeners. Why do I feel pressure down there when I work out?
So a lot of times you're pushing down. So if you think about like when you go to blow up a balloon and you're sitting in a chair, if you feel your pelvic floor push down, what's happening is you're not you're not managing pressure well. Where when you're pushing down, those muscles should be tensing to counteract some of that pressure. And so when people say they have pressure with working out, it's typically because their muscles aren't contracting when they should, and we're kind of holding our breath, or like I said, bearing down. So over time, though, those muscles get tense because they've been pushed into for so long, and they're like crap, and they start to hang on for dear life. And so we actually have to get that muscle tension to release before they're able to fire and support during exercise.
Okay. Next question. Are Kegels really the answer to everything?
They're the answer to nothing, actually.
Tell us
more. So your body never does Kegel. You don't like walk and voluntarily think I need to Kegel every time my heel hits the floor. You know, it's an involuntary response that your body does and should do. You don't think like I'm going to sneeze, I should Kegel. I'm going to grab something, I should Kegel. So I don't love to train it that way. Kegels are good for when people and women have no idea where their pelvic floor is or what it's doing, and they just need overall, where is this muscle? Because it is a hard one to know and to find. And then we're telling you don't shut off your pee when you're peeing because that's bad. And so, I mean, it's good for awareness. Those are what Kegels are good for. Beyond that, we want to train your body like it functions. So we don't want you to have to think of when to Kegel when you're squatting to pick up your kid. We want it to happen naturally. And with proper muscle coordination of all the muscles, your hips, your legs, your feet, then your pelvic floor will fire on its own and you won't have to voluntarily think of it. So we don't prescribe Kegels in our clinic. It's kind of like our thing. We just help people have awareness. We help women have awareness of where it's at. And then beyond that, we've got to work on other things.
Okay. Goodbye, Kegels. No,
seriously, you don't have to do them at stoplights anymore. That's why I always say, like, you can let that go.
Good to know for the listeners.
Yeah.
Me too. Okay, so this question I think is great too. I have older kids. Is it too late to fix my pelvic issues?
It's never too late. It's never too late. And I mean, even we have older women that have been leaking for 30 some years, and we can make headway there. And a lot of times get complete symptom resolution. I always say all the time, like, it's actually sometimes a better time to address it when you have older kids, because now you have a little more time back for yourself.
Yeah.
You're further away from that postpartum time frame. You can dedicate a little bit more of your brain space to it. And so a lot of times women almost get better improvements later when they also aren't, managing small kids.
Right.
So yes, anytime you can get improvements.
I love hearing that it's never too late.
Oh, never, ever.
Which, brings me back to what we were saying earlier. Just because it's common doesn't mean it's normal. Right. It is treatable at any stage.
Absolutely.
And you deserve to.
Yeah, absolutely.
Not pee your pants if you don't want to.
Yes.
With the women that are listening that maybe they just don't have the means or the time and they're not going to be able to make this a priority, are there any just like everyday tips, especially as it relates to like, we hear a lot about like when you're going to the bathroom and things like that? Any basic tips like that might be helpful?
Yes. So I think there is, especially when women are leaking, we're avoiding fluids a lot of the time. And actually, an empty bladder or like concentrated urine is an irritated bladder. So I always tell women, like we have women that are like, well, I don't drink anything after 2 because I don't want to get up in the middle of the night to pee. And it's like, actually, that works against you a lot of the time. So continuing to take in water, even if you have some urinary issues, is always going to be really important. And as far as other tips, I would probably, the exhale. So exhale with effort, like we said earlier.
Any other tips?
I really do like the squatty potty. It helps everyone, even your kids, empty their bladder, empty their bowels, making sure that when you sit down to go to the bathroom, you get a full relax so you can fully empty your bladder, making sure that you're getting water, not just coffee all day because that irritates your bladder.
Okay.
Those types of things. Another thing I'll say is a lot of women experience urgency, like I have to pee now or I'm going to pee now.
Yeah, me. That's me.
Oh, yeah. It's so common. But a lot of it is, yes, there's probably a pelvic floor component, but a lot of it is like your body is being trained that way and it won't untrain itself. So if you are answering that strong urge every time, that's how your body is going to start to give you that urge every time.
Okay.
So instead of running to the bathroom, what we have people do is kind of take a few deep breaths and then actually do some heel raises, like where you go up onto your toes. It's the same nerve that goes to your bladder. And so we can influence that nerve to help calm down the bladder, and then always go slowly to the bathroom. So even if you're like panic, like I am going to go now, deep breath. And I want you to slowly go, just because it's kind of that we say mind over bladder.
Okay.
But
I love it.
It really, really does work. And it's the behavioral component that we work on a lot of the time.
Okay.
So
yeah, I think that behavioral component is really important to think about. I think like for me personally, I will hold it like, cause I'm doing a million things and I'm seeing back-to-back sessions and trying to get all the things done. And then I'm like, oh my gosh, now I have to, it's urgent. Like I gotta go pee. And so, any thoughts on like that?
We would want for you to empty your bladder every 3 to 4 hours.
Okay.
And you should be drinking enough fluid that you should have to go every 3 to 4 hours, except at night. It is hard. We have, nurses, teachers, everyone in the healthcare field, like you can't get ahead of it sometimes, and even us, but you try and stay on that 3 to 4
I love
hour
that.
window.
3 to 4 hours is a reasonable
amount of time, and then always go calmly.
I always go calmly. Okay. Mind over bladder. I think you should get a shirt that says that if you don't.
I'm sure there are.
You don't already have that. Okay. Well, I really just want to acknowledge the load of being a mom and how overwhelming and stressful it is. And there's so many body changes. In your experience, what do you feel like has been some of the most rewarding parts of supporting women?
I think it's just so empowering to watch women kind of, they've had all these symptoms that have held them back from playing soccer with their kids, or it's just always on their mind. And then you can get them to a place that they're like, wow, I can really live without this. And it's almost like freeing. It's just, you watch them be lighter, or you get someone that's had pain with intimacy, had pain with sex for so long, and they actually get to a point where they can enjoy sex.
Yes.
It's just it's so rewarding to watch them and, develop that relationship again with their partner. And it's every piece of my job is so, so empowering and so rewarding. I love all of it.
I love that. I can tell you truly enjoy what you do. And I think that I feel that same way in my industry, which is when a lot of the folks that I meet feel this well, this is just the way life is. Yeah. This is just the way postpartum is. This is just the way motherhood is. And once they kind of get to the other side of the bridge and they find that relief or they find that joy, it's so remarkable to get to be a part of it and see that. And it makes me so happy for people to get to feel that.
I know. I love the patients sending us pictures of their babies. And it's just, we get texts saying like, oh my God, I just had pain-free sex. It's like the best thing ever, you know?
As you should.
Yes. And I mean, we see patients with like, who struggle with infertility and endometriosis, and to like, so we see them through that. And then to get to do their pregnancy visit, like that's one of my favorite things, when they've struggled for so long and they've really worked really hard. And then, you know, it finally happens and we get to see them as a pregnant patient now, and outside of that, you know, that hard, it's so amazing.
And as I'm thinking of that, I'm just thinking of what a gift for these mamas to have that village and that community and that support, because so many of us are going through it feeling isolated or alone, and to have like this team of women like cheering for you and rooting for you and helping you with a plan must just feel so great.
Well, and that's truly why I opened the clinic. I'm just like, can we give women a spot that they don't have to feel like they can hold back, that they're heard, that they don't have to sit in a lobby and have some old guy ask why they're here? Like, let's give them something where they can feel that community and know that even other people you see there are going through the same stuff. Like that, it can feel so lonely, and motherhood just does in general a lot of the time. And so when you have motherhood and then you've got these symptoms, and, you know, to just be a part of something where it's like, this is what we do. It's what we see. This is our normal, you know, this is, you're in
These
good
are not
here.
like weird or odd, or there's something wrong with you. It's just your body needs some extra support.
Yeah. And let us be that. And so we try and keep the clinic, like, as we call it, professional casual, you know, just to be more like a coffee shop. We have patients that always run into their friends there. It's a lot of fun. But just to have a space for women that, you know, you don't have to hold back. You can just tell us no TMI.
Clinic looks super adorable. If folks want to like work with you or find out more about you, where can they reach out or find you?
So we have a lot of information on our website at thepelvicphysio.com. And then we have a lot of fun on Instagram too at the Pelvic Physio.
Perfect. And we will put that in the show notes so folks can find you and follow along. I really want to thank you for joining me on Omaha Mom Talks today for this conversation. Providing all this information is so valuable, and I hope empowering for women that are listening to know that their health matters and to prioritize their pelvic health. So
Absolutely. Thank you.
Yeah, thank you so much. So thank you to all of our listeners today. Remember, taking care of you is a necessity in motherhood. I hope that you always remember that you matter, your health matters, and to get the support that you deserve, just like you give to everybody else. Thanks for listening. Until next time, we'll see you later on Omaha Mom Talks. Omaha Mom Talks. Real moms, authentic conversations, no filter needed.